guys. Thank you for coming in today. I just wanted to talk to you guys real quick to let you know of our current situation. As of right now, we are not making enough money to keep this place going. If we keep going like this, we're going to have to shut the practice down. We've had way too many patients complaining about long wait times. We haven't been able to fulfill the needs of when they need to be treated. So I feel that we need to start making changes. Otherwise, like I said, we're not going to be around for much longer. I've hired a consultant to come in, and the pair is coming in. They should be in here with a couple minutes, and hopefully we'll be able to talk about this and figure something out.
What do you think about this idea of bringing consultants in?
It's going to help us out. I think we should listen to them.
I mean, see what they got to say.
Hey guys, I'm Mike.
I'm Chen.
We're the consultants your boss hired to come in here and try and help you guys. We heard you guys are having some troubles making enough money, so we'll take a look at everything and see if we can help you guys out. Why don't you guys just tell us what the problem is, because we're trying to figure out how we can help you, but we can't do that unless we know exactly what's going on. So it'd help us if you guys just go through a normal day for a patient when they come in.
So our biggest problem is that we're just not generating enough revenue to keep this large facility we just opened alive. I mean, this has kind of been our baby since the start, and looking over the books, we just don't know where we can increase our efficiency.
Well, when patients come in, normally they check in, fill out some forms, see the dentist, go on their way.
How about you guys tell us what your bottleneck is and your capacity and utilization rate just to start out.
I don't even know what that means. I thought that's why you guys were here.
Alright, no problem. So a bottleneck is an activity or resource that limits or constrains the output of a process. So it's basically something in your whole process that slows everything down. Capacity is basically how much you can do in a day or how much you can do in your office. And the utilization rate is how much of that capacity you're using right now. So what's your guys' capacity then? How many rooms do you guys got?
We have 14 rooms, but only 10 doctors. And on average, doctors serve 1 client per hour.
Okay, so that's about 80 patients a day, right, on average? And you guys could serve about 112 patients a day. So that means your utilization rate is at about 71%. After talking to your guys' boss, we got some information. We put together a process flow diagram for you. So according to your boss, your clients check in, which takes around 3 minutes, and they sit in the waiting room for 2 minutes, fill out some forms, which takes 5 minutes. They're waiting in for about 20. See the dentist, which takes about an hour, and then depending on if they need a follow-up, they make another appointment, which takes 5 minutes, and they pay for their service, which is another 5 minutes. So after looking at all this, it's obvious to see that the 1 hour visit to the dentist is your guys' bottleneck, because it's much longer than any other process.
We understand that's our bottleneck, but how do we improve that?
I mean, obviously, the time we spend with the customers is the longest of the whole process, but we feel that the customers are paying us good money, and we need to spend at least an hour with them to provide them the care and service that they've paid for and deserve. How do we overcome this hour bottleneck to make ourselves more efficient and profitable?
Analysis, we realized that by hiring 4 more dentists, you will be able to fix the bottleneck. With more dentists, you will make more revenue by serving more customers, and this will also offset the expenses of hiring more employees.
Opportunity to come in here and kind of analyze your procedure, so I hope that we're able to help, and just let us know if you guys have any more questions.
Hey guys, so after implementing what the consultants have said over the past few months, we've been able to increase revenue. We've retained more employees than we ever have. So I just want to thank you guys for going through with that, and let's keep up the good work.